Okay, well, good afternoon, everyone. My name is Harold Shukla. I'm an outreach coordinator at Crossroads for Hope, formerly known as Cancer Support Committee Central New Jersey, on behalf of Crossroads for Hope and Robert Wood Johnson University Hospital in Somerset. We are happy to welcome you to the second session of Taking Charge of Your Health series. During today's Building Trust with Your Healthcare Provider session, we will have a discussion on trust, creating trusting relationships, and ways trust or mistrust impacts health outcomes. Our presenter today again is Dr. Melissa Richardson, a family nurse practitioner and nurse manager at Robert Wood Johnson University Hospital Somerset Family Practice. Thank you for joining us. And if you have any questions, you can definitely drop it in the Q&A box, or you can drop it in the chat and we'll certainly address it at the end. Other than that, Dr. Richardson, the floor is yours.
Thank you so much. Good afternoon, everyone. Before we get started, I want to apologize for any technical difficulties that we're having. The screen might be a little blurry, and if it is, I do apologize. And I hope you're already having a great day and have and enjoy this session. I'd like to ask you to take a moment, if you haven't already, grab some water so you can have a glass of water next to you to drink and sip during the presentation. Maybe a pen and a paper, or maybe your phone to take notes. My hope during this time is that you'll be able to get one or two things from this presentation that you can either use for yourself or share with your family member. But also, please, if there are any recommendations for myself, I am happy to receive any kind of recommendation you may have. Today, thank you, I have Caitlin helping me with the slides, and so she's going to progress the slides for me today. Next slide, Caitlin. So 2 disclaimers. I am an employee of Robert Wood Johnson Barnabas Health. I work at the Somerset campus, and I've been here for 15 years. And also these slides are being shared from the MD Richardson group. Next slide. And so our objective today is that you will be able, by the end of the presentation, to define trust in your own words, to list 3 characteristics of a trusting relationship, and to state 2 ways trust or mistrust can impact health outcomes. So before I get into the presentation, we are going to have a poll. This is one of a few polls that we'll have during this presentation. We'll give you about approximately 30 seconds to answer, and we do encourage that all the participants answer, and we appreciate that. Okay, so how are we doing with that? I hope everyone was able to answer. It is the healthcare provider's responsibility to build a trusting relationship. If I do not trust the healthcare provider, I am less likely to follow the recommendations for care. And lastly, it takes time to establish trust with your healthcare provider.
Okay, Kevin did the polling.
Thank you. So first things first, we're talking about building trust, but you can't build something that you don't understand or don't have defined. It's hard to build. If you don't have the tools, if you don't have the equipment, you have to figure out what is it going to take? An example would be building a house. You don't just start building a house. What you do is you get designs, you figure out who your architect will be, who your contractor will be, you figure out what kind of materials that you'll be using, location, where will you build, but you got to count up the cost, and you got to figure out, what is it that I'm building? What's my end goal? What are the resources that I need? Who do I need to work with me as I'm building? So what is trust? Next slide. with my current healthcare provider about matters that affect my health? If you can take a moment and answer that. And Haral, do we have the poll question for that? Thank you.
Yep, it's launched. Sorry, my internet
no worries.
For a full 30 seconds.
No worries.
And people are voting. Did you want me to share results for this poll?
Yes, thank you. Okay, so most of you agreed on some level, some agree, and some strongly agree. And that is important. You may say, well, what is the significance of that? Why, what does my honesty have to do with the relationship between myself and my healthcare provider? We'll talk about that a little bit more as we go through. Thank you, Haral. And so next slide, as we think about trust, what are some things that come to mind when we think about trust? You might think about relationship, respect. You might think about shared decision-making or being informed. Definitely communication. Communication is key when it comes to a trusting relationship. You may think of integrity, values, history, even commonality. And so I just want you, as we go through this presentation, to kind of think of, what does trust mean to me? What does that look like to me? Next slide. So trust versus mistrust. Developmentally, human beings at around 18 months or so, we develop this. We kind of learn this trust or mistrust. When I cry, will someone come and help me? If I'm afraid, will again someone come to my need? If I'm hurt, will I get what I need to relieve that pain or that discomfort? We develop that at a very, very early age. And so what's the significance of that? If you're someone who maybe has difficulty trusting or building trusting relationships, it could have something to do with your childhood. It could have something to do with traumas or disappointments from the past. And so I bring that up just to give you something to think about. If you find that, I'm really having a difficult time building trust with family, friends, again, healthcare provider, why might that be? It could be the other person, but it can also be what you've experienced, as a child, in infancy or as a young child. So if needs are not consistently met, then we develop mistrust and we develop anxiety. If the care is not consistent, also, we develop mistrust. We develop anxiety. And it's okay to go to therapy. It's okay to have counseling when you've identified something within yourself that might be a barrier to you being the healthiest that you can possibly be. Working with someone may help you to identify those things. So next slide, what are some examples of trust? Well, this first, click once, great. So the first picture you're gonna see a woman sitting in a chair, that's Michelle Obama. And I chose that picture one because we do this every day. When you sit down at home at the office, you trust that the thing that you're sitting on is going to hold you. And the other woman that we see sitting on the back of the truck, that's the former mayor of San Juan, Carmen Yulín Cruz. This is a picture of her sitting beside supplies for the people who live in her community when they were hit with I believe it was a hurricane. She trusted that her driver was going to get her where she needed to go safely so that she can come to the aid of those who needed her. And the last photo was a photo of a healthcare provider, an indigenous woman who was caring for another indigenous woman. sometimes going to the doctor, dentist, seeing someone who looks like you sometimes is comforting. So our next poll question is, I prefer to receive care from a provider of my ethnic group or groups. Please take a moment and answer that.
Okay, I'm going to share the results for you to see in just a few seconds.
And there are no right or wrong answers to any of these questions. Okay, so quite a few of you are neutral regarding that. Some of you don't agree, and a few of you did agree. The important thing is that you know yourself. You know what your needs are. You know what would make you feel safer. You know that you are going to be able to connect to that provider and work together toward your health goals. And so we talked about what is your definition and what are some words, you know, that define trust, and how do we develop trust and mistrust? We talked a little bit about that. And what does trust look like? And how do we feel about our healthcare provider being the same ethnicity and the same gender? It matters to some and to some not. So characteristics of a trusting relationship. And so I'm going to read these off. Transparency, respect, understanding, speaking up, and time. I'm going to repeat those. Transparency, respect, understanding, speaking up, and time. These are characteristics. These are not the only characteristics of a trusting relationship, but these are some of the characteristics of a trusting relationship. And so what is transparency? Well, transparency goes both ways. The patient being transparent and the healthcare provider being transparent. Transparency is sharing your history, your thoughts, your feelings, just being honest about who you are, about what your needs are, about what your journey has been. And I by no means mean that the first time you meet someone, you're able to just, you know, run this down and just put it all out on the table. But over time, you want to be able to be as transparent as possible, because that will allow you and the healthcare provider to work on a plan, work on your plan for your health so that you can become your healthiest. And the healthcare provider needs to be transparent as well. What am I able to do? What am I not able to do? What are my limitations? What are my strengths? When do I need to refer? You know, bring someone else on board in order to help you to meet your goals. The next one is respect. And respect is self-explanatory on some level, but it's the recognition that an individual has value, that the individual has something to contribute to the relationship. Sometimes I do hear from my patients, you're the expert. And what I've been saying to them a lot lately is, but you're the expert of you. I'm maybe just meeting you, or I'm maybe just knowing you for 5 years. You've known yourself for 20, 30, 40, 50 years. You absolutely are of value in this relationship. And I need you just as much as you need me in order for us to work together toward your health goals. And so the next one is understanding. Well, also respect is regarding the feelings and the rights of an individual. And that's paramount. If you're feeling that your provider's not hearing you and you're not able to navigate that, you might want to bring someone in to help you, and or you might want to find another healthcare provider. So the next one is understand. We need to understand, we, meaning a healthcare provider, I need to understand you. What is your experience? You know, how are you interpreting what I'm sharing? We need to know what your intention is. What are you comprehending? It's not good enough for me to just spiel off medical jargon about a condition and have you walk away not understanding. In addition, I need to take a moment and be quiet and silent and hear you. And so we want that from our healthcare providers. We want to be heard. If I hear you and see you, I'm a better partner. I'm better able to help you regarding your health goals. And the next one is speak up. Speak up. And that's not always easy. And if you're finding that it's a little difficult speaking up when you're at the provider's office, whether you're seeing a physician, a nurse practitioner, a physician assistant, the dentist, the eye doctor, your nutritionist, your physical therapist, whomever, see if you can maybe have someone come to a visit with you, your mom, your sister, your brother, your neighbor, a clergy, someone who might be able to sit with you to start a conversation. Or if you think you can do it on your own, say, you know, doc, before we get started, I want to share some things about how these visits have been going, and say, you know, I don't really understand the medications that I'm taking or why I'm taking them. Or I know I have diabetes, but I really am looking to work toward not needing medication. So can we talk about a plan on how I can do it? You want to be able to talk about your feelings and opinions honestly without the feeling that you're going to be judged. And that goes both ways, but more so for the patient. I don't think the providers have much problems speaking up. It's really important that the time is not monopolized by the provider, but that you as a patient have an opportunity to speak. And so lastly is time. Time is very important. Like I said, when you first meet someone, even the second time you're meeting, you're feeling each other out. You're just kind of getting to know each other. And it might take a visit or two for you to get a feeling of, is this the right healthcare provider for me? Can I work with this person? I will say it does help for you to know, coming into the office, coming into a visit, what is your goal? What are you looking to accomplish? So time is time. It's a measured portion of duration, and it does take time. But if you've been seeing someone for years and you still feel like, I don't know if I can be honest, I don't know if I can trust, or I feel judged, then it might be time to find another provider. So we've defined trust. We talked about the characteristics of trust, and now it's time to build. And so as we go on and we talk about this next portion of the presentation, I want you to think about building with these things in mind. Accountability. Well, who? You. You are accountable for yourself. You're accountable for your well-being, and you're accountable for your own health goals. And you are to hold that healthcare provider accountable to listen to you, to hear what your needs are, and to partner with you on your journey towards health and wellness. Also think about it in terms of community. You don't have to do this alone. As I said, maybe there might be a visit or two where you have someone come with you. Sometimes having someone hear the same things you're hearing kind of helps you out. So when you go home, you can talk about it, you can digest it. Also, having a support person sometimes helps you to ask the questions that might be a little uncomfortable. And last, I want you to think about the time of building as transforming the way you think. You know, how do I think about health? Have I quieted myself and actually took time to think to myself, what are my health goals? What is it that I'm really looking to do? Why am I going to the doctor, the nurse practitioner, the dentist? What am I looking to get out of this? And how do I see myself progressing toward wellness, regardless if you have a diagnosis of diabetes or cancer or arthritis? You can be well even in your illness. So just think about it as we go on. Think about accountability, think about your community, and think about how you can change or transform your way of thinking. So our next poll question is, I have the tools I need to build a trusting relationship with my healthcare provider. Please take 30 seconds or less to answer this question.
Okay, I will share the results now.
Thank you.
Are you able to see it?
Okay, so yes, many of you agree, but there's a couple who don't agree, and that is okay. What I am hoping is that as we go further on in this presentation, that maybe there's some useful information. In addition, if you have more questions than you have answers, please put it in the chat. We definitely will end in time so that we can answer some questions. But if there's something that comes to mind that you think you may need and you think that we can be of assistance, please don't hesitate to ask us. If we don't have the answer, we will work to get that answer for you. So thank you again for answering the poll question. So next slide, time to build. So first thing you have to do is choose a provider. Who do you want to see? Do you want to see a physician, a nurse practitioner, a physician assistant? No right or wrong answer. Usually we'll pick someone who's within our insurance plan. But if you don't have insurance, in New Jersey, we do have the opportunity to have federally qualified healthcare centers. And they're in many of our larger cities like Newark and Plainfield, Trenton, Camden. But if you need help finding a healthcare provider because you don't have insurance, put that in the chat as well. We can help get you connected. So who do you want to see? Do you want to see someone of your own ethnicity? Do you want to see someone of your gender identity? And hopefully within your insurance plan, you'll be able to find that. Do you want to go to a clinic, a physician's office, an urgent care? These are things that you want to think about when you decide, what specialty do I want to go to? What specialty do I think I need? Do I want to go to a holistic provider? Again, these are things that you need to know as you're beginning to figure out who's going to partner with me regarding my healthcare goals. And then your first visit. Before you go to the doctor, think about, why am I going? What do I want to accomplish? You want to write down some questions. And I'll tell you, you're not going to get those questions answered all at once. Unfortunately, the visit times are short. But if you come with questions, you have a better chance of helping to direct that visit. So write your questions down, write them down, prioritize them. Let them know, meaning the nurse, the medical assistant, as you go in, you're there today, but let them know why. Let them know what your expectation is so that they can relay that to the healthcare provider. If you have questions, stop whoever it is and let them know, I didn't understand what you said. I need you to clarify that. I need you to say it differently. If English is not your first language, we have a language line that helps us with interpreting for so many languages, if not so many languages. So stop them and say, I would prefer to have this visit in my own language, and have them reach out to the interpreter on your behalf. And also, before you leave, know, how can I contact you if I have questions after I'm gone? Who did I see today? What is the number? And have that. Sometimes there's also an email address, and with electronic health records, there's also things called MyChart. And what that is the patient will sign up with the provider's office, and they're able to send messages that way. They're able to get their medications refilled that way. They're able to set up appointments that way. So there's not a lot of time spent on the phone. Next slide. If it's an established visit, you do some of the same things. Why are you there? What would you like to accomplish? And do your best to see the same provider if possible. Well, how can I do that? Every time I go, I'm always seeing someone different. Then you stop and you speak with the receptionist and say, you know, I saw Dr. Smith or nurse practitioner Anderson last time. I would like to see that provider again. If they can't help you, you speak to the office manager. But seeing the same provider for your well visits or for follow-ups on the same condition is helpful because you know what the plan is and you guys can work together, you know, toward that. Now for sick visits, you typically will see who's available because we don't necessarily know when we're going to get sick. But you know, you do your best to stick with the same provider. Now, if that's not important to you, then you don't have to do that. But with this presentation, we are talking about building trust. And it's easier to build trust with someone you see over and over again. And as I said, you insist on plain language or your native language. Next slide. So what is important to me? I'll tell you, as a healthcare provider, there are times when we're going into the exam room to see a patient and we have in our head what we think the visit's going to go like, you know, what we are looking to accomplish. We have to stop ourselves and step back and say, oh, wait a minute. I need to ask Mr. Edwards what he came in for today and what he is looking to accomplish. What's important to him. So that's just a little disclaimer. So you want to be honest. You want to set expectations. You want eye contact. If I'm in the room with you and my head is down, writing on a pad or at a computer, you can say, excuse me, and my patients call me Melissa. Excuse me, Melissa, the whole time we're talking, you haven't looked at me once. You know, ask for eye contact. Let the provider know at the visit. It's best if you send me the information via mail. It's best if you email me. I do better with pictures. Everyone learns differently, understands differently. Don't be afraid and or ashamed to say, this is how I need the information so that I understand it, so that I know I'm doing what I need to do to maintain my health and or to improve my health. And identify your biases. What do I mean by that? We all have prejudices. All of us do. We're human. What's important is that we know what those biases are. And knowing what they are, then I'm aware and I can make sure that I'm not seeing through that filter, that I'm seeing Mrs. Anderson as she is telling me who she is and not by who I think she is. So identify your own biases. And if you feel that your provider maybe is not seeing you through the lens that you think they should be seeing you, if you're comfortable, address it. If not, see if you can get someone to help you address it and or change your healthcare provider. But hopefully you're able to work through that. So the dangers of not establishing a trusting relationship. Think of some of these yourself. One is poor health outcomes, withholding important information due to fear of being judged, and lack of confidence in the healthcare plan. Poor communication, it hinders maintenance or improvement of your health, and it causes delay in seeking or receiving care treatment. Let's stay here for a moment. Can you see how not trusting the person who's across from you could be a barrier to your health outcomes? Well, if I'm making a recommendation to change your medication from one thing to the other, based on research, if you really don't trust me or what I say, or that I have your best interests at heart, you're not going to take that medicine, even though what I'm telling you may be 100% accurate. You might delay. You might go home, and Google and call family members and kind of go over and over and over again. You might come to 2 or 3 more visits before you decide, I guess I'll listen to him. I guess I'll listen to her. I guess I'll try this. If you don't trust in the treatment plan, please speak up immediately and say why. Again, what you think and what you understand is important. No, you didn't go to medical school, or no, you didn't go to nursing school, or no, you didn't go to school for nutrition, or whatever the specialty is. But again, you have known you for your whole life. You know that when you get home, you're not going to walk a mile a day to help yourself lose weight. So you might as well not walk out the office with that plan, because that plan is not going to work for you, because maybe your neighborhood is not a neighborhood where you feel comfortable walking. Or maybe your hours are so late that by the time you get home, it's dark and you don't want to walk in the dark. Maybe the recommendation is changing your nutrition in some way. But you know that I'm not going to stop eating white rice because I eat rice with every meal. That's my cultural diet. So don't walk out, don't feel bad saying, thank you for the recommendation, but that one's not going to work for me. Can we maybe think of another? Because if you come up with another one that you can incorporate, then again, you're working toward your health goals. You're feeling better about it. You're actually reaching some of those health goals and you're becoming healthier. So don't hesitate to speak up. And I'm sure you probably have some other things that are dangerous to not establishing a trusting relationship. I'd be happy to hear some of the things that came to mind with this. And so what can trust look like? Well, you see a picture here. You see a provider and you see a patient. And well, what is their posture? The healthcare provider is smiling. She leans in just a little bit. She's looking right at the patient. He's sitting on the bed. I'm hoping he has a little drape for his legs. I'm thinking he probably does, because we usually give a patient a drape if they have a gown on, just for a little bit more privacy. And she has her hands crossed just a little bit, but not crossed as in a closed way. She just looks like, I'm not going anywhere. You go ahead and you tell me your story. I'm here to listen. That's one picture of trust. Just one picture of trust. When someone's standing over you, it's a little uncomfortable talking or sharing. If someone's standing as if they just can't wait to get out the door, you're not going to share that thing that's really eating at you. Or maybe that thing that is so sensitive that you haven't told anyone, but you really want to share it because it is impacting your health. And remember, when we talk health, we're talking mental, we're talking physical, we're talking emotional, spiritual, financial, we're talking all of you. Next slide. And so it takes all of us to work together. Who is all of us? Well, most importantly, you. You, your family, the people you fellowship with. It takes the receptionist, the nurse or medical assistant. It takes the healthcare provider. It takes the specialist. It takes all of us working together to help you with your health goals. Regarding building trust, you can also use these members to help you. First, you want to just take the time and think to yourself, do I trust the person I'm seeing? Are we really working on the health goals that are important to me? Do I even have any health goals? Have I thought about that lately? Have I considered that even though I may have a diagnosis of an illness, that I can still be very healthy and that I can improve some things? Maybe it's my mobility. Maybe it's my nutrition. Maybe it's my emotional health or my mental health. You have to know first what your needs are and what your goals are, and then speak those. Speak up for yourself. Speak with your healthcare provider. And if you need someone to come with you, have someone partner with you. We're going to do another poll question, and this poll question is similar to the one we started with. And that is, it is the healthcare provider's responsibility to build trust. If I do not trust the healthcare provider, I am less likely to follow the recommendations for care. And it takes time to establish trust with your healthcare provider.
So as soon as we get close to the number, I will end the polling.
Absolutely.
Okay, are you able to see it on your remote?
Yes, and so we're split. We're a little split there when it comes to the healthcare provider's responsibility to build trusting relationship, and that's thank you so much for answering that question. Okay, and so as I said, there's no right or wrong answer. What I want to share regarding the responsibility is the responsibility is on us. It's on you and it's on me. So everyone has a hand in it. I want to just share something with you. When I was younger, going to the doctor, when I was pregnant with my first child, I encountered a physician, happened to be a middle-aged white male physician. And at one of my visits, he was very quick and curt and harsh. He said to me, if you can't do what we're telling you to do, don't come back. And I thought, wow, I didn't have a voice back then. I didn't know how to speak up for myself. I thought, wow, I'm pregnant. I have to come back. This is where my insurance is bringing me. And I just couldn't believe that I had such an encounter. The good news is I was able to see a nurse practitioner after that and for my pregnancy and for my delivery. And it shifted when the provider changed. It didn't shift because I even requested her. I just happened to get her, and it was great. I want to say to you, if you have encounters with healthcare providers and you know it's not right, speak up. Speak to the office manager. If the office is associated with a hospital, there's patient advocate office. There's someone always that you can speak to help you advocate for yourself, because no one should feel small or not valued when they're